Hello, everybody. Thank you for attending the Leading Through Crisis seminar by United Board a few weeks ago. I've put together a video on the Q&A that came up during the webinar. We didn't have a lot of time to go through all the questions that you asked, so I'll try and answer some of these questions, and if you have more questions, then we can take them up later through email. I've divided the Q&A into 4 sections. The first are a set of questions related to emotional wellness. And the first question is how to maintain emotional wellness. There are a number of things that we can do to maintain emotional wellness. And this is information that you can readily get over the internet as well. But I think the first is self-care. We need to take care of ourselves, both physically and emotionally, which means that we need to ensure that physically we're doing well, our eating habits are healthy, our sleeping habits are healthy, we have sufficient breaks during our work, we have adequate time given for recreation and leisure. Emotionally, we need to ensure that there isn't negative thoughts that are consuming a lot of our time. We have time to mindfully meditate or think and reflect about what we do so that the mind is fresh and so on. I've also found it very useful for leaders to create very meaningful hobbies outside of work, because for a lot of us, we spend a lot of time on work, on leadership, and when we get back home or to other spaces, we're always thinking about what we should do next. And a creative hobby or an activity outside of this gives us an opportunity to distract and kind of go to a place that is not stressful like the workplace. So I would encourage you to think about that. I do a lot of cooking and a lot of gardening myself. And I'd encourage all of you to think about some meaningful hobby or activity that you can do which gives you satisfaction and meaning outside of work. I also think social support is very important. As leaders, we tend to isolate ourselves and we do not have enough friends. It's good to have a group of friends or family whom we can go to and speak about the challenges that we are facing. Because, like I said in the webinar, not everybody at work will understand, the kind of stress and pressures that we are going through. I think it's also important for us to examine the assumptions that drive work and work performance. If there are assumptions that are quite rigid, for instance, if I think that I should always be perfect in my work, I should never make a mistake, I should always, ensure that my team succeeds in everything that I do. These are great aspirations, but they cannot drive everything that we do. And if we are very rigid in having some of these beliefs and assumptions, then they can take a toll on our emotional wellness. Finally, I would also encourage you, although you're a leader in a highly respectable position, to meet a professional if you feel you have specific emotional challenges. For instance, perhaps you have trouble with managing your anger or your temper, and that's affecting your work, and colleagues and others have said that. So meet with a professional and see how you can work on some of those anger management skills or issues. Or perhaps you're someone who constantly avoids conflict and you do not know how to deal with conflict head on. Perhaps you want to meet with a professional in a safe psychological space and in the safety of a professional environment. Talk about this maybe through a brief coaching session or through even a counseling session. Let's go on to the next question. The next question is about suicide. And just a couple of days back, September 10th was World Suicide Day. The question is, what is the most number of reasons why good leaders on extreme cases succumb to suicide? Well, I must tell you first of all that suicide is an experience that any of us are prone to. It does not discriminate between a leader, a follower, person in one profession, a child, and so on. In fact, if you look at worldwide statistics of suicide, you will see that between the age group of 15 to 49 to 50 to 59, there's a very high risk group. In some countries, older people are at risk, but in a lot of countries like India, for instance, younger people are at risk for suicide. And it can cut across any socio-economic group, any professional group. We must remember that suicide is often a reflection of poor mental health. Although the demographic reasons that is reported for suicide may be things like violence or family problems, financial stress, and so on, there is always a mental health component which makes a person vulnerable for suicide. And therefore, it's important to keep ourselves mentally healthy all the time. Secondly, a lot of research on suicide, especially research reported by the World Health Organization in the classic report of 2016, tells us that suicide is also an impulsive act, which means that somebody who is otherwise not vulnerable to commit suicide, who is perhaps not depressed, can commit suicide on an impulse. And so the implication of this is that as leaders, we should know how to deal with unexpected stress. If I am not used to dealing with criticism, or if I fail my team and I feel shameful, at an impulse, I might actually think of taking my life. And to avoid that, it's important that all of us confront with the reality of working with conflict situations, working with unexpected situations, maybe go through some simulations of that in our mind, prepare ourselves, improve our conflict resolution skills, and so on. So these are two major reasons why people do commit suicide in leadership as well as in other fields. One is because there is an intervening mental health condition like an underlying or subclinical depression, or because it's on an impulse, something has happened at the workplace which you didn't expect, you feel very shameful, you feel a lot of self-hate, and at an impulse you think of taking your life. To avoid that, it's important to prepare ourselves for such situations through adequate conflict resolution skills. As a side, I think for all of us to keep our mental health in check, it's important, like I said earlier, to ensure that we take care of ourselves. We have good emotional management skills, healthy coping, do a mental health check from time to time. And this is something that is not very common, but for those of you who have EAP services in your organizations, I'd encourage you to schedule an appointment with your psychologist or with your counselor or your mental health expert, and just talk about your stress and some of the challenges you might be facing, just to be sure that you're doing all right. And for those of you who are leaders here in administration, if you have the power and the resources to set up employee assistantship programs at higher education institutions, please do that. It's a big need of the hour to have wellness services in our institutions. It's a low priority in Asian universities, but we really need to pay attention to that and do that. And finally, like I said earlier, always have strong social support networks. So even if you feel suicidal at an impulse, you have a death wish, you feel really bad about a situation, you know that there's somebody who's willing to talk to you in a non-judgmental situation. Let's look at the next question. What can you advise or say to leaders who are also having mental health issues? Right. So we are still talking about mental health here. Now, I think the first thing we must remind ourselves is that mental health is a legitimate health issue. And if mental health is a legitimate health issue, then we must do everything in our capacity and in our part to ensure that it's addressed at our workplace. Mental health is associated with a lot of stigma, as you probably know. World over, there is consensus that it's difficult to talk to somebody about your mental health issue because of the stigma associated with it. So we'll need to consider ways in which we can reduce stigma. If you know there is a leader around you who has a mental health issue, then speak to that person in a non-judgmental manner. Show the person that you care. Help the person to understand that mental health issue is just like any other physical health issue. In fact, depression, which is the most common mental health condition, is popularly called as the common cold of mental health. That's how common it can be. I think it's important also for us to create safe psychological spaces to speak about mental health, because there's often a tendency to stigmatize, to invalidate, or to play mental health issues low key priority areas in our wellness. Very often there are culturally mediated beliefs about mental illness and mental health. So you might have people at work believing that mental health is not important. Maybe you're not doing work because you're not interested in work, or maybe you're too lazy or you're procrastinating, when it's actually a sign of say depression. I would also encourage you again to think about employee assistantship programs and institutionalize them so everybody knows that there is a service, and talk about that service. And it'll be great if some leaders actually speak about their own mental health challenges and how they overcame it. Most countries in the world, when people in positions have spoken about mental health conditions, it has led to destigmatization, kind of neutralizes mental health issues, and makes that something that people can actually talk about. And finally, provide some real information to address the issue, because there can be a lot of biased information out there about mental health. So it's important to have the right information. Mental health conditions can be treated if they're severe, they can be prevented, There are things that we can do to improve our positive mental health and our well-being. So let's make that part of all our institutions' agenda, at least now, because wellness and mental health is important, an extremely important predictor of productivity. Let's move on to the next slide. And here, this is a little technical, so I've placed a model here. The question is it only about the leader's emotions, but also external factors, dot, dot, dot. Leaders can't be sadhus. Sadhus is a term that is used for a group of people who are, detached from the rest of the world and live on their own. So leaders can't be sadhus who are not driven by emotions, but when they react, they face the consequences themselves. So this is how I want to answer this question. You're right in saying that it's not all about a leader's emotions and there are external factors. So that is what I call as an antecedent. So let me just take the pointer out so I can work with you. So antecedent is an external factor. For example, you've gone to a meeting and at the meeting your presentation didn't go well and your boss criticizes you. So that's an antecedent. Well, the criticism of your boss is not in your control. It's external. When that happens, within us there is an emotional response. Maybe there's a thinking virus. Maybe you feel upset. Maybe you kind of feel those uh, you know butterflies in your stomach, and you feel a deep hollow feeling in your stomach. You feel like the whole world is just going to collapse in front of me. Whatever those emotional responses are, there are beliefs and assumptions that we hold that will heighten those responses. It can make it worse. So if you are the kind of person who has a thinking virus which says that I'm a failure in everything I do, or whatever I do is not good enough, or my presentation didn't go well, so it means that I'm not going to be liked by anyone in the organization. Those beliefs can actually increase the emotions that you're experiencing. Now, this part of the situation is in our control, right? Because we are experiencing it. Our emotional responses will determine the second part of this model, our behavior. So if you're able to manage your emotional responses, appraise your beliefs, and then react in a particular way or respond in a particular way, then the consequences can be different. So there are always two aspects to these sequences. Aspects that are within our control, which is our emotional responses and our beliefs, and aspects which are outside our control, which are the antecedents and the consequences. How we manage our emotional responses can determine the way we behave. So you might want to take a deep breath and just tell yourself that, hey, it's okay, I'll do better next time. Let me see what I can learn from this. And then say, thank you for the presentation, and I'll try to work on this. Then you've responded to the situation positively. And what could be the consequences? Maybe your boss is upset with you for a little while, right? That's normal. Maybe there's a bit of bad feeling for a little while, but later things are going to change. But if you become very negative, frustrated, you get withdrawn, you're passive aggressive, you sulk, maybe you lash out, then those consequences can further make the situation worse for you, because our negative responses can then make our leaders or those around us think negatively for us. So if my presentation didn't go well and I get frustrated and say you're never happy with what I do, I just don't know, I don't want to work with you, then that behavior can lead to a consequence which can further, you know, uh, impact how others view us. So in conclusion, it's not just our emotions, but also external factors. But we have control over our emotions. And if we can use our forebrain, our prefrontal cortex, to think about our emotions and to manage them effectively, then our behavior will be one of response rather than reaction. And that's the way we can deal with these situations. So remember, we can never control the behavior or consequences of other people. We can only control and manage the behavior, the emotions, and beliefs of ourselves. Let's go to the next slide. Does emotional well-being differ based on our profession? Yes, there is research to show that certain professions demand much more from us emotionally, and they're often professions where we do a lot of work with people on an intensive level. For instance, right now with the COVID pandemic, we know that frontline workers are under a lot of stress and their emotional well-being is affected. There have been a number of suicides. There have been a lot of trauma that is happening now with frontline workers. Typically, people in healthcare, people in education, people in counseling professions are impacted on their well-being because they're giving out so much of their emotions to the work, and their work is emotionally draining and it can impact wellness. However, any form of profession can have impacts on well-being, uh, ba- depending on the situation that you're in. So if you're in a situation that's highly demanding, you have deadlines to meet and you don't have time to take care of yourself and you're constantly working, well, that impacts your emotional wellness. What can a leader do to avoid negative emotion in the context of injustice and poverty? This is an important question, and this is a question that comes from a lot of us who work in places where the larger structures that we work in are not just, and there are also challenges like poverty, the lack of resources, and so on. I think it's very difficult because emotions like anger and frustration are very common in the context of injustice and poverty, and it's a normal response to injustice and poverty. As a human being who is interested in justice, in fairness, in equity, anger and frustration are almost like our bed partners. They're always there with us because we just cannot see the injustice that is going on. However, like I mentioned in a previous question, I think it's important for us to know where to place these emotions. We cannot avoid these emotions, but our response to the emotions can be modified. So I understand why I am angry at injustice. I understand why I'm frustrated with the lack of resources and poverty. What can I do with those emotions? One, don't let the emotions bother you for a long time because it can take you into a negative spiral. And then you can feel, you can kind of beat yourself up continuously, and that's not good for your wellness. You can use your prefrontal cortex here and say, hey, I have these emotions. I know that it's not just, but what can I do now to make sure that, I can bring about some equity and I can do the best in these circumstances? So having realistic aims really helps in dealing with some of the emotions that are associated in a time of injustice and poverty. It's also useful to convert some of these situations into actionable research and find solutions and use our anger and frustration to motivate us to bring about a change in society or in the institution that we are in. That's what a lot of people do with action research around the world. Let's move on to the next question. This is a personal question. Dr. George, can you share your practical tips to be more realistic with the working condition that is not ideal based on your experience or presentation? How do you maintain your stress levels so that it will not drain your emotional tank? I thank you for asking that question. One of the things that I do is I keep telling myself that working conditions can never be ideal. You know the saying in English that the grass is always greener on the other side. And I've learned through my experience working at a couple of institutions over the years, first at a major medical college and hospital, a psychiatric center, high institutions of higher education with non-governmental organizations. Working conditions can never be ideal. I used to have a very idealistic assumption about life, and I've learned to tone it down a lot. So one message that I have learned is be realistic, don't be idealistic. I would also say it's important to do our best in tasks that we have full control over. There are some things that I do at work, I have full autonomy and I can do them very well. But there are some things at work over which I do not have much control. I need to collaborate with others, and others other people may not have the same ideas that I have. So I need to understand that working with them, collaboratively, perhaps sometimes politically, is important if the organization has to proceed because people are not the same. And one of the stressors that I used to have over the years was trying to do things the way I wanted to do things because I think that's the best way to do it. but I realized that it's important to work hand in hand with others and to let go of some of my expectations. Trying to change situations that we don't have control over can actually drain and deplete our emotions. And that is something that I've learned over the years to do. Don't try to change situations we don't have much control over. Let that be there. Do the best you can. And we're working in a system where multiple people are involved. And don't spend too much time thinking about it and stressing yourself up. Just do your best in the things that you can control. So these are some practical tips that have really worked for me when the working condition is not ideal based on what my expectations are. The next question is how I can identify my own weaknesses in nurturing my emotional well-being. First, self-awareness. To identify our weaknesses, we need to be persons who are self-aware, which means that we should know what our blind spots are, what our strengths and weaknesses are. It's not that easy because a lot of blind spots are blind. That's why they're called blind spots. A lot of our weaknesses are hidden and can only be seen by other people and in our interaction with others. Therefore, it's a good idea to talk to people who can mirror you. So it's always good to look at a mirror. And one of the best mirrors for you could be a colleague whom you trust, but who is willing to be critical. Or you could speak to a loved one at home or in your friend circle who you can trust. There's a typo there. It should be one who you can trust to give you feedback. Right? Talk to somebody who you can trust to give you feedback. And that will be, quite helpful for you. Then you can see some of the areas that you need to work on and your weaknesses. Watch out for these signs. Sometimes prolonged bouts of fatigue, if you keep feeling tired all the time, you can't sleep well enough, and it's prolonged for a long period of time. You tend to be forgetful. You have negative thoughts coming into your mind constantly. You kind of feel burdened all the time. You have disturbances in your appetite. Perhaps you notice that you're annoyed and irritable a lot more than you normally are. Some of these are warning signs that you need to nurture your well-being and that you're going through stress. It's also a good idea to take an inventory of irrational beliefs, and I can send you send you links to some of these inventories if you write to me, and I'll give you my email at the end of this presentation. Personally, for me, I remember an anecdote when I was working as an intern in my clinical psychiatry program initially. I used to spend a lot of time in the wards in the hospital talking to patients, providing psychotherapeutic services, and so on. And one of my supervisors called me and said, she told me, Tony, you seem to be like doing much more than you're expected to do. Why are you doing that? You'll soon burn yourself out. And I realized from that feedback that I need to really cut down on my pace. What she discovered is that I was doing a good thing. I was helping my clients and the patients in the hospital and so on, but she also recognized that perhaps I'm doing this not for the right reasons. Perhaps I wanted to validate myself. Perhaps I liked the gratitude that I got from working and giving to others and so on. So that kind of feedback is very helpful, and I hope that there is somebody you can trust who can give you that kind of feedback, and that is a sure way to start working on your weaknesses. Let's look at some questions that came up in the Q&A that were related to thinking patterns and thought viruses and so on. So here's a question which asks, is positive self-talk an antidote to thinking viruses? And how do I balance that with also identifying and calling the reality? Right. So I would say that realistic thinking is an antidote to thinking viruses. So I would not want to use the term positive self-talk or negative thinking or positive self-talk as an antidote to negative thinking, but I would say realistic thinking, right? So positive thinking can sometimes also be a thinking virus because we think in ways much more than we should think about ourselves, right? And positive self-talk can have limitations because they tend to calm ourselves down, and of course they help to direct us to our worth as individuals. but sometimes they may not address the reality. So, what I would suggest is assess the situation, look at the situation from all angles, including your own failings, and see if that is helpful in dealing with your thinking viruses. So, when you have a sense of the pluses and minuses of the situation, you know exactly what the situation is like. If there is something that you need to improve as a person, then work on it. If you think that you've done your best, and other people haven't understood you well, then accept that, because you know that you've done your best. So realistic thinking is really an antidote to thinking viruses, not negative thinking or not inflated positive thinking. Here's another interesting question. What if I have a competing personal belief that is contrary to the truth on a positive note? For example, I do not appreciate public praise from my team on my leadership. Well, competing beliefs are neither positive nor negative. They reflect our inner world as they are. So, if accepting praise or appreciation from the public is difficult for me, then you must explore why it's a problem for you. Because in leadership, what we normally expect is that leaders have the grace to accept praise when it's due. If you've done something, then gratitude will come to you, and it takes a lot of grace, it takes a lot of maturity to actually accept that gratitude, because it indicates that you actually care for yourself and your worth. So, if I respect myself, I appreciate myself, then I have no qualms in accepting praise from others when I do something that requires it. So I would encourage you to look at the assumptions that you hold about receiving praise. Is it, for example, a way in which we invalidate ourselves? If so, why do we do that? So ask ourselves these questions about the beliefs that we hold on any personal, competing personal belief. And like I said, a competing personal belief is neither positive nor negative. It's just a competing belief that restricts us from functioning effectively and efficiently in leadership positions. How do you break the pattern of the clash of personal beliefs and leadership truths? It's a good question. In fact, it requires a lot of practice and experience. But the first step, like I said earlier, is self awareness. So figure out what your personal beliefs are and why are these personal beliefs clashing with leadership truths? What are the sources of that? Is it a previous experience? Is it a style that you've developed over the years? Is it part of your culture that you're expected to behave that way? So the first part is self-awareness. There are several tools that can help you to do that, and I'll be happy to help you with that if any of you need that kind of an assistance. The second is to reflect on that self-awareness. Why am I the way I am? Why do I function this way? Is it again coming from my experience, from my culture? Is it an expectation that I've placed on myself or an expectation from others? Once you've made that assessment, I'd encourage you to use the tool that I gave you in the webinar, which has the 4 quadrants where you can kind of listen to your inner world. Practice behavior that is contrary to these personal beliefs. So start practicing these behaviors. Initially, it becomes a little, it may feel a little artificial and difficult for you because you're not used to doing that. So if I go back to the previous question, if accepting praise is difficult for you after you've done something well, start accepting praise. Tell people thank you for your feedback. I really appreciate it. Saying that helps establish new patterns of behavior. And actually, in the brain, research from neuroplasticity tells us that it establishes new neural pathways in our brain. And as we practice these behaviors more and more, they become part of our life and they become stable ways of engagement. Like I said, I'll be happy to send some material or help you with some tools if you like. Here's another question about rewards. What we learned from you in the early, leaders should not receive any rewards from the person they leads. How can we deal with it in some traditional community? First, let me tell you that I did not say that a leader should not receive any rewards from persons they lead. Leaders should not expect to receive rewards because those whom we lead may not want to give those rewards to us. The example that I used was that of children who do not appreciate the worth of what their parents have done for them until they are much older. So, one of the truths about being a leader is that we may not receive rewards from those we lead, and we should not expect rewards from those we lead, because if we expect those rewards, then and our expectation is tied to our happiness and to our self worth, and if we do not get those rewards, then we can feel upset and it can affect our emotional well being. But rewards may come, and if rewards come, then we need to accept it gracefully. And it's a reflection of the gratitude that people have towards us. And as people become more and more mature in our team, they are likely to appreciate the work that we do, and we are likely to receive more and more gratitude from them. Let's go on to the next question. So the next set of questions are general questions about leadership and well-being. So I've clubbed them together. Let's look at what the first question is. Why is it that despite having good leaders, team players may still play indifferent? Example, silence and indifference. Well, I think if you look at the psychology of each person who comes to a team, they come in with their own life stories, their own needs, their own backgrounds. Everybody comes into a team, perhaps asking a question: "What is there in it for me? How am I going to survive through this situation?" and so on. So people are not necessarily looking at the leader all the time. They're also looking at themselves and what their needs are, and what they need to do perhaps to survive through this situation and so on. And people come with different life stories. So despite being a great leader, um, it is not always likely that people will follow us in what we do and work with us if their own needs are not met. However, I would also encourage leaders, if you notice silence and indifference in your teams, to ask yourself, is there something that you are doing that you're not able to reach out to those in the team? Is there something, that you're not connecting with the team? Is there a need in the team that you're not seeing? um, is it that you are a good leader in your own sense, but for them the definition of a good leader is something else? So it's also a time for introspection for us, and to see if we are actually connecting with everybody in our team. Remember, it's not always possible to connect with everybody. There are some people in our teams who should not be there. But having said that, if you see silence and indifference, it could be a reflection of your team strategy itself, or it could also be a reflection that they have needs which are not being met in the group, or they're playing out their own lives or their own unfinished business and projecting that onto you. These are different possibilities. Will moving out on on our comfort zone can help us to be more better as a leaders? How can we cope with our doubts? Well, I've just taken the questions as you typed in, so I've not checked the grammar of any of these questions. So the questions are just placed as you have typed during the webinar. So the question is, will moving out of our comfort zone help us to be better as leaders? And how do we cope with these doubts? I think moving out of our comfort zone will help us to become better leaders. I think so. I strongly think so. Getting out of the status quo, and this pandemic has actually shown that very well. I think leadership requires us to push our boundaries, take risks, and enter into a space of uncertainty. And sometimes it's that push that we do to the boundaries, or those risks that we take, that helps us to move to the next learning curve in leadership. So I think that's important. But along with that, like you have said rightly in your question, there are bound to be doubts. Doubts are normal human responses, and we must permit them to be there, because doubting often helps us to think twice about what we are doing. But we should not be led by them. So the doubts can sometimes incapacitate you and make you so cautious that you're not willing to take the first step. So I would say, let the doubts come, but let the doubts help you to take that risk and then assess that situation afterwards. I think a careful evaluation of our plans, pros and cons, can give us a reality check of the risks we take. And as leaders, we need to accept uncertainty, discomfort, and doubts are part of the process of moving out of our comfort zone. So let the doubts be there. Don't let it incapacitate you. Accept them and move on with the doubts forward. And let the doubts be like a beacon or like a nudge, a catalyst to help you to take the risk forward and the doubt can perhaps just give you a word of caution, just so that you're a little careful about the risks that you take. A general question: what type of leadership can be followed during the crisis? I think the next webinar that United Board has planned for us will actually answer this question in a more meaningful and purposeful manner. But what I have learned during the crisis situation is that we need to be decisive. We need to consider the situation as not a normal situation. We need to attempt to maintain continuity as much as possible, and open to learning and embracing our vulnerabilities as much as possible. I think very often crisis situations can take us into a stage of fight, flight, or freeze. So if we are shocked by what is happening and then we just remain numb and we don't do anything about it, that's poor leadership. I think we need to be on top of the situation, take decisions very quickly in an agile manner, and we have to move forward even though we do not have all the data with us. I think it's important to maintain continuity as a leader. So our actions should, help uh, the students and our teachers in higher education, for example, to continue to do what they're doing even during the crisis situation, so that we don't spend a lot of time just being overwhelmed by the crisis, and maintain that continuity as much as possible. And I also think that during the time of leadership, we should be open to the fact that we are vulnerable, we'll make mistakes, and we must learn through the situation, making mistakes and embracing our vulnerabilities. But like I said, I'd encourage all of you to tune into the next webinar that United Board is planning for you, a masterclass on leading with the heart and the head in times of the pandemic. And I'm sure that webinar will answer this question much better for you. Here's a question about expectation. Can there be, or we demand or expect too much from our team? The question is, can there be a situation we expect too much from our team? Yes. Or can it be that we demand or expect too much from our team? That's probably what the question is. Yes. I think sometimes leaders have very high standards that may not be consistent with the abilities of the team. So if you're a high functioning leader who's thinking of quality, of standards, of your own personal standards are so high, the team may struggle to put up with your standards. This team may almost personalize that all of them have to perform exactly the way you expect them to perform. And that expectation can sometimes be daunting for team members. So realistic assessment of team strengths and individual differences will be very helpful. It will also be good in such a situation as a leader if you can share some of your own struggles with the team, so that they don't see you as a superhero or a superman or a superwoman. And then they realize that you too are like one among them, that you're a human, you're vulnerable, and that kind of reduces the pressure on them to, like, match up to your to the standards that you have in mind. So I would suggest, have great standards that you aspire for, but when you push people to those standards, push them in a human way. Let them know that you're human. It's not easy, there are struggles, and it's okay if they struggle to reach the standards. And if possible, let those standards be standards that you can set together through consensus, so that the team is fully subscribed to them. Let's go on to the next question. How important is it for a leader to be liked? Would respect for his or her capabilities and effectiveness be more important? Yes, I think respect for capabilities and effectiveness is more important than being liked, because being liked, again, is comes from an emotion, or comes from a belief uh, that we have nurtured over the years in our lives as individuals, where being liked is directly related to our self-worth, and we estimate ourselves based on whether people like us or not, which is not helpful, because likability is not in our control, and different people might like us for different reasons. It's also possible that if you consider likability as a standard, then we might compromise on important values and integrity. Many great leaders are not liked, not because they're not good persons, but because they take a stand which other people don't like, and those stands are often stands of integrity and high ethics. So the need to be liked for us as leaders may be coming from a place of unresolved needs, and it can also compromise our objectivity in leadership. So yes, I think respect is something that we need to look for, and not being liked by everyone. There's a question that borders on personality psychology. That is, personality, what impact it has on emotional well being. Are there ways that this can be addressed? Yes, personality impacts emotional well being. A lot of what I've said in the webinar and otherwise are rather uh, are statements and principles that kind of cut across different people. But sometimes our own personality can come in the way of well being. For example, if you're someone who's very high on perfectionism, which is a personality trait that we see in some leaders, right? Or if you're somebody who's very cautious, always thinking twice or three times before taking a decision, or if you're a person who is low on harm avoidance, that's someone who just wants to take the risk all the time and so on. These are all examples of personality traits that can impact your well-being. So going back, if you're high on perfectionism, and all of us are perfectionists to some extent, but if you are really high on that and you're very rigid about that, then we will want to work ourselves so much that it impacts our health, our well-being, and so on, because we're never happy with what the product that we're doing. So personality definitely impacts well-being, and it's great to have a sense of what kind of personality you have. I would encourage all leaders to take a self-assessment of our strengths and weaknesses, our personality traits, and the styles in which we function. There are several tools that can help you to do that. I can send you some names, but I put two common tools there: the Clifton Strength Finder and the Strength Scope. But there are several other tools, and I'll be happy to send you links to some of these tools where you can examine yourself, look at what your personality traits are, and then some of these tools will offer you an opportunity to be coached by somebody from the organization briefly, so that you can further work on your personality and kind of mediate some of the high or low personality traits, so that you're more balanced in your approach to leadership. Here's a general question. Fear towards our health and the economic instability is leading to emotional stress. Yes. In a student's perspective, his or her future is under pause. How do we overcome these? I would say for us as teachers, as administrators, educators, we need to really think practically of our resources and needs, especially during the time of the pandemic. Um, and if possible, take some coaching advice, because we might need practical help on how to proceed with the kind of work that we're doing, especially if our resources have been affected. uh, I always find it better to talk to somebody and take some advice from somebody we respect, who has knowledge in these areas, who can help plan our life. In fact, livelihood planning is science by itself today. So think practically of your resources and needs, take some coaching advice if required, and then take small steps one day at a time, that you can actually work through these difficult times. For students, I think in the pandemic time, considering that this question is about the challenges during the economic instability during the pandemic times, I would say help in ways in which continuity can be established as much as possible, and figure out ways in which you can harness existing online resources to help them continue their learning. I think a lot of students have huge fears and anxieties and mental health challenges during this time, but a strong, supportive statement from teachers, from their professors, from their educators, and practical ways in which they can continue their education and their move towards career even during these difficult times can help settle a lot of those anxieties. So some form of structure in this chaotic time will be very helpful for students, and we can be ambassadors, or we can be the agents that bring that structure to the students during these difficult times. It's also important to look at maybe organizations that are uh, picking up resources for students who can't have access to some of these resources. I just heard from a colleague in the Middle East how They were able to provide laptops and tablets to students. So in several colleges in the Middle East, when the pandemic first started, so that the continuity was established. So if there are practical things we can do with public support and with other well wishers, then we need to do that so that students can feel safe within the structure that we provide for them. Here's a personal question. Can you briefly describe what changes in your attitudes and beliefs about leadership that the pandemic has sparked? These are some lessons I learned from the pandemic. One is we must lead from the front and not be bogged down by the pandemic. Because when the pandemic struck, everybody was in a state of crisis, not knowing what to do. There were rumors going around the place. There were a lot of theories about the pandemic. There were theories about what we should do. There is political pressure from upstairs, from the government and others, about how we should function as a university. And I realized that what we need to do as leaders is stand up in the front, not be bogged down with pandemic, and give a sense of direction to those we lead. And that's perhaps not always something that we've done, because as much as we are leaders, we've also looked up to others for direction in terms of regulatory bodies or in terms of the highest administration of the university. So it's good to some. I mean, I think the pandemic has taught me that sometimes we'll have to just stand up and um, lead from the front, because everybody else is really vulnerable at that point of time, as much as we are vulnerable too. I also felt that it's good to act decisively in the best interest of students and teaching community. And I'm saying this because there were several viewpoints, even from students themselves, about continuity of learning. There are students who continue to say that they don't want to learn, they don't want to go to the university, it's a tough time, and so on. But I think just looking at the science of human development itself, sometimes we are in a great position to make a decision in the best interest of our students, especially considering their future in mind. And I think we should not stop ourselves from taking those decisions. I've learned not to be afraid of taking risks. That was a question that was asked earlier. I've learned that I should not let the crisis to affect continuity of learning or the things that we normally do, but to see how we can continue in new circumstances. I also learned that many things I believed about myself was exposed during this pandemic. So a lot of vulnerabilities that were not exposed because the conditions were right earlier were exposed now, and that taught me that I should start working and improving in those areas. I have also learned to look for help from the unlikeliest of places. Some of the suggestions that I've got for some of the leadership decisions I took came from the unlikeliest of places and from the unlikeliest of persons and places that I would have normally not looked to for advice. So it's really opened up my world in terms of who I can depend on, who I can listen to. And I think finally I've learned that it's important to keep communicating constantly to stakeholders during a crisis situation. And it's not enough to just sit back and think and plan all these things myself. Thank you for that personal question. Uh, this is perhaps the last question that I'm going to address today. Do we assume that emotional well-being and leadership has a cross-cultural validity? I looked up research on emotional intelligence, and emotional intelligence is closely related to emotional wellness. And there is research to show that there is cross-cultural validity, especially in the business sector, in social sectors and community projects, and in the healthcare industry. We don't have enough research in higher education to look at cross-cultural validity, and I'm hoping that some of us here can actually do that kind of research. But if I just extrapolate the findings from other work sectors, then I would say that there is cross-cultural validity when it comes to emotional wellness in leadership in higher education as well. Of course, there are cultural factors and there are social factors that mediate the way leaders project themselves. But at the end of the day, I think emotional wellness cuts across all cultural barriers, and leaders in any institution, any culture, need to look at well-being, and it really improves or impacts their leadership positively. Well, thank you very much for the questions. If you have more questions, please write to me and I'll be able to answer them. There are a few questions which I have not answered, which I think are not in the preview of wellness, so I've left them for other webinars to address. But thank you once again for the opportunity to do this webinar for you, and I wish you all the best. Please write to me or to United Board if you have any further comments or any questions, and we'll be happy to serve you. Thank you very much.